I always knew that I wanted to be a doctor. I had dreamed of being a pediatrician since grade school. I worked hard through high school and undergrad, striving towards that goal. I went to UCLA for undergrad and selected my major, psychobiology, largely because it met the highest number of pre-med prerequisites. In order to get more exposure to the healthcare field, I studied to become an emergency medical technician, and I worked with and shadowed a number of physicians. I prepared for and took the National Standardized Exam for Entry into Medical School, the MCAT, but I didn't submit an application for medical school at that time. The closer I got to applying to medical school, the more horror stories I seemed to hear from physicians about how dissatisfied they were with the practice of medicine. They warned me that times were changing. They were forced to spend less time with their patients, and they felt frustrated with how much more control insurance companies had over their abilities to practice. Here were people doing what I had always dreamed of doing, and they were miserable. I had a bit of a quarter-life crisis. Instead of applying to medical school, I moved to South Africa for a year. Then I moved to San Francisco, where I got my emergency teacher's credential and began teaching special education. Shortly afterwards, my older sister was diagnosed with leukemia. The diagnosis came as a life-altering shock to our family. I spent the better part of the next 9 months in the hospital with her. I kept track of all of the medications she received, the reactions she had, her blood counts, everything. I became my sister's advocate, and I realized through my time in the hospital with her that medicine was my true life's calling. About 3 months after my sister's diagnosis, I met Dr. Wolfgang Gilley. Dr. Gilley asked me how my sister was doing. I started to give him a list of her most recent blood counts and what chemotherapy she was on, and he interrupted me. He clarified, "How is your sister doing? How is she handling everything?" He was the first physician in 3 months to ask about my sister, the person behind her leukemia. I was shocked. I told him about her struggles, about how her life had been turned upside down, and how difficult it had been to go from her typical daily life one day to suddenly spending months in bed in the hospital. He encouraged me to see that my sister's mental health was treated, as well as her leukemia. He explained that she may be better able to recover if all aspects of her health were addressed and treated. I told him that he was the first physician to ask about my sister, the person. He explained that he was a DO, and as a doctor of osteopathic medicine, he was trained to look at all aspects of an individual in order to best determine their individual diagnosis and treatment. I decided then and there that I wanted to be an osteopathic physician. Over the next few months, my sister had her mental health addressed, as well as her physical health. She recovered from her leukemia, and I applied exclusively to osteopathic medical schools. I was accepted at my top choice, Toro University, California, College of Osteopathic Medicine. I went on to complete my pediatric residency at the Children's Hospital of Los Angeles, and am now back in the Bay Area, working as a pediatrician and a faculty member at Toro. I have since realized that practicing patient-centered, individualized care of the whole person is not exclusive to DOs. There are many MDs who also take all aspects of each individual patient into account when devising a diagnostic and treatment plan. One of the differences is that this approach to patient care is emphasized from the first day of osteopathic medical school. It comprises the first of the 4 foundational osteopathic tenets. The body is a unit. The person is a unit of body, mind, and spirit. It is an approach that I value highly and that I am thrilled to practice and teach daily. I would love to hear about why you chose osteopathic medicine. You can find me on Twitter at Dr. Hendrix.